So I'm just going to give people a few seconds to filter in. And so just to welcome everybody to our Simon talk this today, which will be, we're joined by Nat O'Connor from Age Action, who's going to talk about older people and their housing needs and how they're being met or not being met in the current system. We, as I say, these Simon talks, sort of the formulation of them, the way we think them through is there are a number of people and agencies that we would work with and think with when we're developing our policy around housing and homelessness and sort of our understanding of the housing system in particular. And we felt that sort of one of the things that we could do was sort of share that information or find ways of sharing that information. So you're not just getting the Simon version of how our experience tells us what this means, but also it creates a space where people can, you know, think about these ideas in their own context. So this chat is also, as you'll see when you come in, is also recorded, and it will be put up on YouTube, our YouTube channel after this. If you're tweeting about it, and please do, you can use the hashtag SimonTalks. So with that, just to give you the brief bio for Nat, Nat has worked on social and economic policy for over 15 years and has worked in Dublin's what was Dublin's homeless agency. It's now DRHE. He was director of the think tank TASC. He worked with the Labour Party and the Oireachtas and at Ulster University and Maynooth University. He's an author or co-author of a range of publications, including Ireland's first comprehensive report on economic equality. Nat has a Master in Politics and Social Policy from the University of Dundee in Scotland and a PhD in Politics from Trinity College Dublin. And with that, I'm going to hand over to Nat.
Thanks very much, Wayne, and thanks, Anna-Marie, and thanks to the Simon communities for inviting me to talk about older persons' housing needs, and particularly their unmet housing needs. So I'm going to speak for about 25 minutes. So I have my timer on, so I'll crack on immediately. I mean, Age Action is Ireland's leading advocacy organisation for older persons, and we're advocating for society that enables all older people to participate and to live full, independent lives. And in preparing for this talk, I was drawing on three sources. There's a forthcoming Age Action publication on the state of ageing in Ireland that I co-authored with my colleague Mary Murphy, a recent presentation we made to the Oireachtas Joint Committee on Housing, and a submission we made on housing to the UN independent expert on the enjoyment of all human rights by older persons. And so very much we're trying to understand the housing situation of older persons, the full diversity of their lived experience. And so we've been exploring the data, and I'm going to share some of our findings with you today. First of all, we all obviously have a need for housing, for shelter, but for more than shelter. It needs to be adequate housing, it needs to be decent housing. So that's the first thing we're looking at. And it's both a need and, of course, a human right in the human rights framework. And so, for example, putting the right to housing in the Constitution, it's not meant to create that right, but to acknowledge in our law, in our legal system, something that is already existing, that Irish governments have already acknowledged in the UN Declaration of Human Rights and various covenants, that housing is one of the fundamental human rights. So, but what do we mean by housing? We're not talking about sort of luxury housing or perfect housing, but this concept of adequate housing. And I'm going to say a lot more about that as we go on, so that as a society, you know, it's right that we enforce decent standards of housing, that we have both building regulations, but inspections, and a whole range of processes and systems to make sure that people's quality of housing is up to a certain standard. And that doesn't matter if they're a homeowner, a social housing tenant, someone in the private rented sector, or indeed somebody resident elsewhere where their home might be in a care setting or anywhere else. They have the same need for adequate housing, and the same quality standards should apply. So that's the core idea here. And so what is adequate housing? Well, in '91, the UN Committee on Economic, Social and Cultural Rights adopted General Comment number 4, the right to adequate housing. And it gives 7 elements of what they regard as an adequate housing: legal security of tenure, the availability of services, materials, and infrastructure. So, for example, as simple as access to clean drinking water, electricity, waste collection, and so on. The third element is affordability, so that you can afford your housing and it doesn't jeopardize, quote, the attainment and satisfaction of other basic needs. So that, the cost of housing has to be kept within certain reasonable bounds. The fourth element is habitability. So there's adequate space. It's protected from rain, from damp, from cold, from mold, and so on, that it's a physically adequate space for you to live in. And in Age Action, we would identify accessibility as a dimension of that. So if you need ramps or handrails or so on, that's something that we've separated out, in fact, as an 8th dimension, and I'll be talking about that as well. But back to the UN framework, the 5th point is access. And what they mean specifically here is that you can get access to housing, that you're not discriminated against and excluded, or that you can, that there's not an undue waiting time to get access to housing. So there has to be, whether it's in the housing market, the rental market, or in getting access to social housing, that the whole system is accessible to all categories of people. The 6th element is location, that you have from your home can get access to things you need, such as healthcare services, as well as basic shops and services. And finally, cultural adequacy, that the housing should be appropriate to and meet your cultural needs. So that's the framework. And I'm going to come back to saying a bit more about that. As I say, the General Comment came out in 91. One of the provisions of the comment is that all signatories, including Ireland, will review the situation periodically. And in fact, it was 2021, just last year, that the Irish Human Rights and Equality Commission published Monitoring Adequate Housing in Ireland, which is a useful report looking into these 7 grounds, obviously from a rights perspective. But focusing in on older persons, first of all, what do we mean by an older person? Age Action is looking at anybody who's age 60 or older, although we're also concerned with policies that affect all of us as we age. But when you're looking at many national statistics, often they might use age 66 or older. Of course, the state pension age is 66. Sorry, many national statistics use 65, which is often a mandatory retirement age. So there's different thresholds used and often different blocks of statistics available. But why older persons? Why do they have particular housing needs? Well, probably first and foremost, the crucial issue is income. As recognized by NESC in the Developmental Welfare State report, at a certain point, there is little or nothing you can do to increase your income as an older person. If you've left employment, if you've left economic activity, and you're reliant on your state pension, presumably as your core, maybe an occupational pension, whatever savings you might have, and for many older persons, that's typically not a lot of money. And of course, you may or may not own your home or have other assets, but your material circumstances are frozen at a particular point in time. And of course, that can degrade. And particularly, I'm thinking if you own your home, they can depreciate in terms of its habitability, its quality, in terms of you may need to change your roof or change your windows or upgrade your heating system or so on. So income and broadly wealth is the key reason why, when we're looking at older persons, there's a concern, because people are not in a position to get overtime or to do something to expand their income to meet their needs. So there's a much bigger reliance on the state and on the systems that are available to help people. So that's the first reason to look at older persons. Secondly, there is health status, speaking broadly, so illness, disability, frailty. And of course, there's a reality that as we grow older, there's a greater incidence of disability and so on. Now, we have to avoid stereotypes that all older persons have a disability. In fact, most older persons in surveys will report they have good health or very good health, massively so compared to those who report that they have bad health. Likewise, 2/3 of people age 65 and upwards do not have a disability or a serious impairment. Now, in some cases, people may be managing an underlying condition like high blood pressure or back pain or whatever it might be. But most persons in older age are actually in good health. But obviously, the reality is, particularly as we come into our 80s and 90s, and most of us happily will live into our 80s in terms of the longevity which has been achieved in Ireland. So we have those considerations about having housing that is suitable in terms of grab rails and so on. So that's the issue there. But we need to avoid sort of an ageist stereotype about elderly people and needing special elderly housing, because that very much narrows the conversation. We need to broaden it out to the full diversity of experiences. And of course, there's the third reason why it's so important that housing policy looks at the area of older persons, which is demographic changes. There are over 1 million people in Ireland who are age 60 or older. That's more than a quarter of all adults. So already you've got a very large population. The number of people who are aged 80 or older, if you like the older old, there's about 170,000 people today who've reached that benchmark. That's going to more than double by 2035. So in just 13 years, we're going to have far more people who are in their 80s and 90s and indeed in their hundreds. This is a tremendous success story, but it's likely to mean when it comes to unmet housing needs, the scale of the challenge will quickly grow. And so it needs to be met by a response, including by the state, which is going to be at the same scale to meet that challenge. And there's a strong sense that we are not ready as a society for some of these challenges, not least issues such as dementia, which are likely to double in number and so on. Now, there's a persistent myth that older persons are okay when it comes to housing. You'll hear that older people own their own homes, older people are wealthier than other age groups, the state pension is high compared to other European pensions and so on. And there are so many problems with these myths. And while it's true that most older persons own their home, most isn't everyone. 1 in 7 older persons is in a different situation. I will explore those. And even if someone owns their own home, that doesn't mean that they're adequately housed or they can meet all their housing needs. And again, in the 7 aspects, or indeed the 8 aspects of housing adequacy, we'll see that there's many gaps. And of course, wealth among older persons is highly skewed. House prices are skewed. And as I said earlier, most older persons don't have a great deal of cash savings. We know that from CSO wealth surveys, half of older persons have less than €6,000 in the bank, and often they have little or nothing in terms of cash savings, which means that they don't have capital to draw on to improve their housing situation in many cases. And indeed, incomes in older age in Ireland are on average much lower than in other EU countries when you take into account work-related and private pensions. So the overall income replacement rate in Ireland is around 34% against a European average of 52 or thereabouts. So there's a lot of concerns about this idea that older persons are sorted for housing. Because of course, looking back, the state provided a huge amount of incentives and supports for people to become homeowners, many of which no longer exist as pathways into home ownership. But just because people may be homeowners doesn't mean that they're in an ideal situation. So I want to get into the details of the housing adequacy and the question of whether older persons have the choice and control that they need over their housing situation. First up is tenure. So as I say, most older persons are homeowners. 4 out of 5 own their own home outright. But about nearly 6% are still repaying a mortgage or loan on their home. And there would be a concern of nearly 10,000 cases where there is a deep arrears going on, or there's certainly arrears going on in the mortgage, the majority of whom are in deep arrears, which is to say more than 2 years behind in their payments. And of course, if you're in a situation where you've lost your ability to work in your 60s, getting beyond those arrears is particularly difficult because, again, you mightn't have the capital to draw on to pay off your loan, and you can be really caught in a very difficult situation. 1 in every 42 older person households, just nearly 2.5%, is renting from a private landlord. And this number is increasing. In fact, there's an ESRI report out today looking at the private rented sector, and they note that more older people are renting. And there's an interesting chart showing, looking back to the generations, more and more people are renting over time. So what we're likely to see is a greater number of older people coming into renting into their 60s and 70s. And of course, our rental system is entirely based on short-term lets, or mostly based on short-term lets. So there's a question of how would people keep up? And of course, how would people afford their rents on a fixed income in older age? About 4% of people are living in a care setting. So that is their home. They might be living in a nursing home or a similar context. So that's predominantly people in their 80s and older. So it's about 29,000 people of any age at the last census. Of course, you don't always have tenancy rights. You don't always have the rights of a homeowner. So that's another issue in terms of legal tenure that can be missing. And then we have obviously the extreme examples of people. There's at last count, nearly 120 people age 65 or older living in emergency homeless accommodation. There's around 10 people, the last roughly per count, who are found to be sleeping rough on a regular basis. And of course, there are older people in the asylum system, in direct provision, and now in the latest numbers, at least 1,000 Ukrainians aged 65 or older have come to Ireland and of course are in a precarious housing situation. So in terms of security of tenure, there's a large number of older persons who are in difficulty. Moving on to the availability of services, materials and infrastructure. Again, census is our main source of data here. For the most part, the situation is looking good, but there are nearly 8,000 households with no central heating. There's another 1 in 7 households, nearly 14%, which rely on burning solid fuels. So they may have a back boiler in terms of a heating system, or they may simply be reliant on a fireplace. There are about 18,000 households which rely on individual treatment of sewage. They have neither a septic tank nor a public scheme, and over 1,000 houses had no sewage facility, according to the census findings. 1,200 households with a person aged 60 or older with no piped water. And of course, many older person households don't have internet access, 40% or so, but of course that could be a matter of personal preference, although obviously in terms of rural broadband, the option isn't always there. So in terms of availability of services, there are limits too. Affordability, 2.5% of older person households struggles to pay their mortgage or rent. An estimated 20% may be unable to afford to maintain their home or to improve their housing situation. So there's various issues there. Obviously, if you own your own home, the issue becomes not one of paying on a weekly or monthly basis, but having sufficient capital. And there's 3 directions in which people may need to afford major changes to their home. One is in the sort of standard upkeep, whether it's changing the roof, repainting, or whatever it might be. And of course, people can lose the capacity to do some of these things for themselves, even if they were handy at the DIY. So they're relying on getting in contractors to do more and more work that others might do for themselves. The second issue is then in home insulation, where most older houses have poor insulation. So that's an extra area where people are looking to put in the loft insulation and so on. And then of course, the third area, which I'll come on to, is accessibility, the cost of putting in handrails and so on. So there's a number of different affordability issues there. But obviously the most obvious one is those who are renting in the private rented sector. We know average rents easily over 1,500 a month, driven by higher rents in the larger cities, obviously in Dublin, but still in rural areas, 700 or 800 typical rents. Putting into context, a single person on the contributory state pension getting the maximum rate is less than 1,218 a month. So it's barely enough to cover the entire rent of a 1-bedroom dwelling in Cork, Galway or Wicklow, never mind being unable to cover it in Dublin. So if you were on a very modest income and you're trying to rent, you're very likely to be pushed out into a peripheral area. And of course, you're looking for the cheapest possible accommodations. So that's a major concern. So moving on to habitability, this is the largest area of concern in relation to unmet need. There's about 500,000 houses in Ireland which have the lowest insulation, a building energy rating of E, F or G. And based on research from 2014, our estimation today is that at least 300,000 of those houses are occupied by an older person. So the issue of poor insulation is disproportionately an issue affecting older persons. And of course, as I mentioned earlier, these are households likely to have the lowest incomes, least likely to have the kind of wealth you would need to do a major upgrade to your home. And obviously there are grants available, but there are gaps in those systems as well. And I'll come on to a bit of that. So that's a serious concern. So other surveys have shown 1 in 8 older persons are living in a dwelling with, quote, a leaking roof, damp walls, floors or foundation, or rot in window frames or floor. And a comparison with Northern Ireland recently in a paper found that about 160,000 houses in Ireland would be classified in the lowest level of poor housing, requiring nearly $1 billion of retrofit. And it is argued that would potentially save 1.3 billion in terms of health costs. So obviously the issue here is that it's very expensive, this sum total amount of repair. Of course, if we don't do it, we're looking at greater health costs, which is obviously a cost to the state, but more importantly, it's a cost to the people affected by poor health because of the poor quality of their housing. So again, I'm conscious of time, so I will press on. Getting access to housing. Obviously, it's largely a function of income and or inherited wealth. Most people are expected to provide themselves with housing. What we see is that there are now a growing number of older persons on the waiting list for social housing. And nearly 2 in 5 applicants have been waiting for 5 or more years. So there are access issues, and of course they're likely to grow, particularly if people in their 60s who might be renting, who can no longer keep up with rent, who fall back seeking social housing and find that they're in a very long waiting system. They may become reliant on rent supplement, HAP, and so on. So issues there. Location, it's another concern for any of us in terms of the quality of housing. About 1/3 of older persons are living in cities, mostly in suburbs rather than city centre environments. And indeed, there's quite a skew to the older suburban areas. Another 3 in 10 are living in towns, 1 in 6 living in a rural area, which is close to an urban area. But then there's about 1/4 of older persons who are living in more rural areas, which the CSO defines as at a moderate distance or indeed highly rural or a remote area. So at least 1 in every 11 older persons, so 9.2%, are in a highly rural or remote area. So it's highly likely that they may have difficulty getting access to services. But even those in suburbs can have difficulty getting access to services if they don't have the public transport they need. And of course, as you grow older, there can be issues of maintaining your driving license. What we see with people age 70 plus, there's a gender bias. Men are much more likely to have a driving license than women. And so as people get older, if one partner passes away, you can find a situation where people no longer have the ability to drive. And of course, I mentioned capital earlier. Many older persons can't afford to replace a car when it breaks down, or maintaining their car, it becomes a major expense and a major concern. So then finally, cultural adequacy. And of course, the traveller community is those who are most affected in terms of the inadequacy of housing to meet their needs, recognised as an ethnic minority community. So for nomadism, for example, or the type of housing that travellers might choose, so that's an issue. There are, unfortunately, very few members of the traveller community make it to age 60 because of the early mortality among travellers. But there are about 1,500 travellers who are age 60 or older living in Ireland as of census night, most of whom are in their 60s. So there is a potential there for a failure to provide culturally adequate housing to those who may choose to have it. And of course, looking forward, we're likely to see a lot of more religious minorities and ethnic diversity among the population of people who are older. And that could also manifest in cultural issues. For example, if people want to be near a community centre or near a place of worship. So the 8th category of housing adequacy, which we want to discuss, is accessibility. For many older persons, obviously the handrails and so on, about 1/3 of people age 60 or older has a disability, but the rate of disability increases. It's about 1/4 of people in their 60s, rising up to 3/4 of people once you're into your 90s. And so at a certain age, people need things such as, plugs and lights at accessible heights, avoiding unnecessary steps, having in ramps, wider door frames if you have a mobility aid or a wheelchair, moving a downstairs toilet, which often many older houses don't have, perhaps moving a bedroom downstairs. So there's quite a lot of building work that might be involved. And of course, if you don't have it, then we can regard your housing as potentially being inadequate. Now, there are local authority grants, and in the last 7-year period, about 25,000 housing aid grants for older persons were allocated. Similarly, another 14,000 mobility aid grants. So this will help with a lot of the things that I've mentioned, but our analysis of the data, I mean, there's gaps in the data here, but it seems likely that about 10% of older persons have unmet needs for accessibility aids. So I want to just summarize, what we're seeing here. Between 3 and 7% of older persons may have difficulties in relation to their tenure, having an insecure tenure, not having long-term renting, for example. About 2% of older persons may have a difficulty in relation to services, particularly the lack of central heating, no proper sewage treatment, or no piped water. At least 2.5% of older persons have a difficulty with affordability, including just paying rent, for example. But much larger numbers could have all sorts of different problems with costs. About 20% is our estimate when it comes to things such as home repairs or retrofitting out of their own resources. The biggest category of unmet need is habitability. At least 48% of older persons are living in houses with a building insulation of E, F, or G, which gives them the highest energy costs. And as we've seen at the moment with the rise in prices, that's a serious concern for people's ability to keep their homes warm, to maintain their health and well-being at home. So that's the largest level of concern. There are other issues to do with environmental noise or damp and rotting in the windows that I mentioned earlier, but the main issue there is the home insulation. We estimate that about 10% of older persons may have unmet accessibility needs. At least 1% of older persons, those who are waiting for social housing, may have access needs where they're not getting access to housing fast enough. And then an unknown number, at least the 9% of older persons in remote rural areas, and probably a great deal more, have difficulties in relation to the location of their housing, their inability to access local services, shops, GP, pharmacy, and so on. And of course, transport is crucial there. And if you lose your ability to drive a car in our car-dependent society, in our car-dependent way in which we've built housing, then the locational adequacy of your house becomes a major concern. And then finally, small numbers of people affected by the issue of culture. So overall, we don't know what the overlap is between these different forms of adequacy, but the biggest number is 48% in terms of home insulation. There are other issues there. So we know that at least nearly half of older persons have at least one major need in relation to their housing. And it's certainly not beyond the bounds of possibility to say 1 in 5 older persons, has a level of need that it just needs intervention. So again, I'm conscious of time, but I'll just sketch out a couple of solutions. Obviously, there are the Warmer Home Scheme grants, the SEAI grant systems, and so on. The National Retrofit, more money has been put in through the carbon tax revenue. So a lot is happening there. Priority is being given to households who have an E, F, or G home insulation, but that's not going to kick in for a year because there's a backlog. The issue there at the moment is the lack of labor force. So the pipeline of workers to deliver home insulation, there's a backlog. And of course, you don't get the free retrofit and therefore the priority unless you're on fuel allowance. And only 1/3 of older persons are on fuel allowance because it's an income-based payment. It's means tested. So as a result, there's at least 85,000, probably more, older person households in those poorly insulated housing who are not getting the rent supplement and who are not eligible for the free upgrade. So they're caught out. We've proposed an energy guarantee payment that would help them, as well as proposing that they should be made eligible for the retrofit schemes. So there's a just transition concern in relation to the whole climate issue, that there's more focus put on the poorly insulated housing, because that is the core housing concern for older persons. But obviously, there are lots of other concerns. There's the issue of income adequacy. If people had a stronger state pension, they could afford to be more able to meet their own needs in the housing market or in relation to home repairs and so on. But the issue that people have such low incomes and relatively low cash savings for many people means that there's simply that issue of not having the money to be able to afford or to access the housing that they need or the housing improvements that they need. There's other things that can be done in terms of obviously building more social housing to reduce the waiting times for older persons. But there's also things in the private market. There's a lack of financial products that would allow older persons to right size their homes. We've talked to people who they might own a home that's worth 400,000 or 500,000. They own it outright, but they can't get a loan to allow them to buy a smaller, cheaper home that might be more manageable, because the banks are only looking at their income to see whether or not they give them a loan. There's not asset-based lending from the mainstream lenders. So there are financial barriers that are stopping people from, those who choose to right-size their home, from making that choice. Obviously, we need long-term tenancy protection, indeed lifelong tenancies. If someone is going to rent and rent from their 60s through to their 90s and beyond, then they need that long-term rental protection, that they're leasing somewhere that's going to be their home for the rest of their lives. So of course that legal protection doesn't exist as things stand. Housing standards have got much better. The near zero emissions housing is excellent in terms of home insulation and low cost. But of course, that's only the newest housing. So retrofit's an issue, but also universal design. I'm sure many of you will be familiar with the principles of making sure that walls are sturdy enough that you can put up a handrail. It's not always as simple as simply attaching a handrail onto an existing house. Sometimes the built fabric isn't strong enough, particularly in some modern built apartments, that it can't take a proper handrail up to the quality standard to make sure it's safe. Likewise, putting in an accessible bathroom. So there's important building elements to make sure that our housing stock is good enough for universal design. And of course, it should be universal. This idea that only a percentage of housing needs to have universal design, what does that mean? That people won't be allowed to have older relatives come to visit? That people who need mobility access, will have a lower choice when it comes to perhaps the rental market? So there is a need to expand out universal design to improve as a services element of housing adequacy. Obviously, public transport options is a major concern. And of course, where we locate housing, so that if people are reliant on walking or public transport, that they can get access to the things they need. There's a whole range of personal supports. So we're now waiting for the statutory home care scheme, which will enable people to live at home for as long as possible. This idea of aging in place, which most older persons are very clear that they want. People would much prefer to age in the communities where they have built their lives, whether it's their same home or they can move to another manageable home in the same area. That's missing. And we need to legislate to incentivize models of housing that are currently missing. So for example, in Australia, nearly 6% of older persons live in what they call retirement villages or retirement communities. But they've had to bring in strong legislation so that if people are promised a range of sort of medical services or entertainment or facilities in their retirement villages, that there's a strong contract that protects people, particularly as they get older. We simply don't have this here. So as a result, we haven't developed that sector. But the argument in Australia is that over 1.4 billion euros, so 2.2 billion Australian dollars, has been saved because people have delayed their entry into older age care or to healthcare because they've been able to access retirement villages. But this model of housing simply isn't possible unless you have strong legal protection. And the final thing I want to mention is not to forget those who are furthest behind, the people who are living in adverse circumstances, whether it's prison or, of course, homelessness, as the Simon communities are working on. And of course, many older persons, if they're leaving prison, may find themselves really at risk of homelessness. So to mention prison, as of May of last year, there's 114 men aged between 65 and 79 in prison, some on long sentences, and 5 men who are 80 or older also in prison. And that doesn't include people who might be there on pre-trial remand or under immigration law. Now, we know that life in prison is associated with the faster onset of the health issues associated with aging in terms of appearance and health problems. So there's both a housing issue for those who are in adverse circumstances like prison or emergency accommodation, who need all of the adequacy of housing that everybody else needs. But of course, we also have to think about what are the needs going to be of men who leave prison, as an example of people who are aging in the most adverse circumstances who need also to be able to access adequate housing. So that's a whistle-stop tour through some of the findings we've had. As I say, on Age Action, on ageaction.ie, we'll be launching our report into the state of ageing in Ireland soon. And of course, that'll include housing among the dimensions that we're looking at. So I'll stop there.
That's brilliant. Thanks, Nat. And the questions are already starting to come in, which is great. So do put any questions you have into the chat box there, and I'll put them to Nat. First one is already in, so it's from Sarah, and thank you for the session, which I think goes without saying. Lots of food for thought. When it comes to housing for older persons of migrant and minority ethnic backgrounds, there's a very heavy reliance on the private rental accommodation, which comes with the issues you've outlined, which is tenure and isolation. Is there any specific support available by Age Action or other groups for such individuals?
Well, it's difficult to say. Obviously, there are a number of organizations that provide housing and are specialized as housing associations focused on older persons. But there is a huge gap in terms of there is simply not enough social housing in the system for people of all ages. And this is an increasing concern. Now, Age Action has an information helpline, which is open some of the days of the week. And you can ring 01 475 6989. So that's our information line number, where you can get more specific advice to help individuals navigate the system. But more broadly, you know, there is a lack of housing. So people are often reliant on the private rented sector, and with all the problems that entails.
Okay. And I think that kind of leads us on to some of the meat of what you were talking there. I mean, I suppose, the primary concern of the Simon communities, as you said, is homelessness. And what we're seeing actually in our advice and information services is more and more older persons coming from the private rental market at risk of homelessness. And you know, there's a lot of work that goes on to try and divert them from having to enter homelessness services. And indeed, certainly particularly in the Dublin area, there's a very clear strategy by the local authority to try and prevent people from having to cross the threshold of a homeless service, or if they're in it, that they're in for a very short period of time. Now, I think everybody recognises we're in the midst of a housing crisis. The rental market it's contracting, but also the reliance on it is so heavy. The two things are kind of joining to show some of the lowest levels of properties available and very high prices coming up. One of the things in terms of the flow through the housing system, as we age, and as you say, that's a really positive thing. There isn't the right sizing options. There's the financial issues of people having that capacity to move, which means that probably the churn in the housing system is also slowing. Even in terms of family members, you know, inheriting a home or you know, that kind of natural flow, and whether people are going to move in together. So I think we probably need to rethink how we think about life cycle housing. And I was struck by also the access to services aspect in the rural situation. And if we're saying people have to rely on the private rental market, and the demographics would say more and more people are going to have to, unless we massively expand our public housing. And combined with that, they're being pushed more and more to the peripheries as their incomes don't allow them, every time they have to change. So if they're staying in a tenancy for 2 or 3 years, and it's increasing by 2, 3, 5% every year, and their incomes aren't keeping pace with that, they're going to be pushed more and more into the suburbs or beyond to find a place to rent. And that pushes them away from their services and from their communities, where they've built up sort of capital resources to help them to manage any difficulties that may come with being older, which is going to be harder to manage, you know, in communities that you're not a part of. So I'm just wondering, I suppose I'm veering into statement rather than question. In fact, I veered. But I guess part of the answer is definitely more public housing. But are there other answers that we should be looking at?
I think there certainly are. I mean, you said a lot of things there. I mean, one is the fact that in the housing that we've built, a person could be living in a community of their life. As you say, they have their social connections. Those are so important for positive and healthy aging, to stay active, to stay involved in things, to have wider connections. But it might be an area where we just built family houses. There are no one-person apartments or smaller housing units, or the kind of 1.5 person apartment where there'd be room for a guest bed for someone staying over, or maybe even for a nurse later on. So we haven't built the right type of housing in the communities where people are currently growing old. So there is a need, and of course there's an option of pepper potting, you know, the right kind of housing in the areas where they're needed. So a lot of suburban areas, for example, there would be space to put in little apartment blocks, but designed to meet that need of people who want to stay in their community, where they know people, they know the shops, they, you know, they have the GP and so on. But there simply is no type of housing. And of course, a financial product, local authorities can give mortgage lending, wouldn't be a huge stretch for local authorities to be able to give bridging loans to enable people, those who want to move out of their home, you know, out of their existing property into somewhere else, to do so. You know, we talked before about the long leases. You know, we have to bite the bullet and think that certain people should be entitled to get a 10-year lease, 20-year lease, a lifelong lease, which are absolutely common in other jurisdictions, allowing a person to, maybe if they need to rip out the kitchen and replace it, or modify a bathroom, to really have ownership of the space for as long as they live, and, you know, not the short-term lets model that we are stuck with. And that's a big change for people who own property, obviously, as landlords. But that's, you know, it's increasingly obvious that if we don't do that, we're going to have an enormous problem. And that gets back to the issue of, exactly, you say, it's not just about the demographics, because you can look at the census, and the next census would be interesting, the number of people, the number of older people, and of course, the longer that people are living. It's that wider dynamic of, as you say, people are staying in their houses for longer. So, you know, you could reach your own 60s and you could be looking after your parents in their 90s. So the idea that you're going to inherit their house in your 40s or 50s to pay off your mortgage, so a lot of these assumptions that are built into the housing market that affect the kind of the percentage availability of different types of housing every year, all of those assumptions have to change. So we need to remodel our understanding of the housing system, and to see that actually there's going to be a lot of constraints in a lot of different variables that's going to just limit the availability of housing, because people are living longer. And it is good news, but we are not ready in terms of our housing system to deal with that.
I think that's I think there's a lot of really good suggestions. I think given that financial issue, the bridging loans from local authorities would be in some ways a throwback to when local authorities used to provide affordable mortgages to people. That would make immense sense.
I see another question here coming in from Haley there in Focus, doing a survey with older tenants. So it would be great to ask the tenants about the sort of the 7+1, so the 8 forms of adequacy, in terms of if you come up with questions, depending on how long a survey it is, obviously. But, you know, because you might be surprised. For example, do you have tenants who would prefer to be closer to a church or to a place of worship? That's something that you might not have factored in as terms of the cultural adequacy of where they're situated. Finding out about their transport, their ability to access transport is another key thing. It's obviously much easier in a large city, but we know in rural areas, you know, 3% of older persons are using public transport in rural areas because there isn't any. So there's a lot of differences there. So those would be, I mean, it'd be good to be able to go through the questions. It'd also be very good if you're doing a survey to be able to differentiate between the different age groups. So in our state of aging report, we're looking at people in their 60s, 70s, 80s, 90s and older. And you'd see very different profiles. You know, you wouldn't put people in their 20s and 50s together. So why do we put people in their 60s and 90s together? The same gap. Very different profile of needs for different ages. So it's great if you can get the data that allows us to see those differences more clearly. So that'd be another thing to have in the survey. So I see Suzanne Rogers has a question in relation to people in their 50s, they're private renting. or in long-term mortgage arrears. You know, is public or social housing the only real solution? Not necessarily. It's obviously the most obvious solution. Another possibility is that the state is going to end up paying the rent through some sort of rent supplement or HAP for the rest of a person's life. So it's a form of social housing, if you like, where the state is paying the rent to a private landlord. I don't know if that's a solution, but it's certainly a likely outcome of the system. If someone could get a long-term rent, a lease, and I've known people in their 80s who were renting in Dublin city centre. This is going back 10, 20 years, but they've obviously been renting for life because they were already in their 80s, maybe paying a shilling for their room. But you see less of that now because perhaps you have less accommodating landlords willing to just rent the back room. It's all seems to be maximizing profit. And certainly there's that issue of at any moment, your tenancy could come to an end for some reason. So you need that rental protection. Go ahead.
That's really interesting because there is a move in the Department of Housing to look at the tax treatment of landlords. And, you know, while we have a system where people are treating the housing as an asset to be sweated and to get the maximum out of, then it seems to me that, you know, you're just by reducing the taxation, you're just giving more benefit to the asset rather than to the individuals. But if something like that differential treatment was tied to a long-term lease rather than sort of short-term rental, then there may be a win-win situation over time, particularly as with the gaps you've mentioned there. So I think that's something that definitely warrants looking at.
The other thing to mention, if I may, is the retirement village option that the Australians have. Part of the argument there is that it's entirely private sector. So it appeals to people who have a higher income, who have higher wealth, but who may decide to sell their home to become a renter as part of a retirement village. Now, they need those long-term leases, plus they need a solid contract to protect them to get the services. Because unfortunately in Ireland, we've heard a case of people who thought they had got that, and then 10 years later, the owner sold their retirement village, which became a residential village, and all their services were closed and taken away. So you need that protection. But as a mechanism in the market, by creating these retirement village options that people can go into, obviously that frees up housing in the system. So that's another way of simply opening up the housing market and opening up housing possibilities for older persons. And so there is scope to look at, particularly for people who have the higher income or the wealth, who may choose to move into a retirement community, to have that as something, as an alternative to the public or social housing, to come back to Suzanne's question. That is actually a model. And as I say, I think it's 5.7% of Australians over the age 65 are living in this type of setup. So it's a very large housing option there. I'd say it's less than 0.1% here. So there's scope over the next 5-10 years to see real development in that way.
Are there other options like that? I mean, that sounds like a very good one. And I think we have I was at another event recently, and somebody made the point that when we find something that works somewhere else, what we'll do is we do a pilot. But actually, we know it works. So why are we doing pilots? Why aren't we just going out at scale? And that's a big frustration in the housing space. I'm just wondering, I suppose, you don't want to sort of create a space either where you do lots of little things, but are there other kind of big things that should be considered?
Well, I think the other maybe blindingly obvious thing, of course, is apartment living. And because overwhelmingly 95% of older persons are living in houses, and the few that are living in apartments are more likely to be in an old local authority flat complex rather than necessarily modern apartments, although there's a beginning of a move. People are choosing to move into that as a form of right sizing. But we haven't necessarily thought about apartment design as the place someone's going to live for 30 years. So as I say, the kind of the 1.5 bedroom model, where if you're an older person living alone, you don't necessarily need a second bedroom, or you can't afford a 2-bedroom setup, but you might need a box room for relatives staying over, or the nurse, or someone, a carer, so that you have this option. Building that in, for example, you might have bigger storage needs, but you see that for obviously families with kids as well. You may have different needs in terms of just the simple universal design steps, avoiding trip hazards, having everything on the level, having the strong walls to put in handrails. So building that into apartment design, again, and it's also cultural. We haven't envisaged that we're going to have older persons living in apartments, but it's an attractive option, particularly if people lose the ability to drive, that they could come downstairs in an apartment and be on the main street of a town and have access to all the life of the town and to be fully participating in that, in that activity. That's something to be culturally sold to people, but also the physical, properties need to be there and they need to be affordable. So that's money is in some ways the bottom line.
Yeah, because that's the other thing people in this conversation often, and you did reference it because it's important. The HAP rates is where, as you say, if somebody has had a level of income where they've been renting, that wouldn't have allowed them, or they wouldn't have met the income criteria to get on the local authority housing list. They then transition onto their pension, and all of a sudden but they're day one on a housing list at the age of 65, 68. Yeah. So given, it's 5, 7, 10 years on the housing list, that's a long time. So then they're going to be reliant on a HAP payment. And they may at the first, on today's rates, they'd have to be topping up if they were pretty much anywhere in the country. But even if those rates increased, the stagnation in HAP rates in the way that they have been run so far would mean that their income over time is not going to be able to keep up as rents continue to outpace both inflation and increases in payments. So the sort of the confluence of things and the pressures seem to continue to build unless we address this issue fairly quickly.
Yeah, I think to put it bluntly, as I said, we're not ready for the shift here. We're looking at twice as many people over the age of 80 in 12 years. So that has huge implications for accessibility of housing, the type of housing that's suitable, as well as for the home care supports and so on. And a proportion of those people, more people in their 60s and 70s will be private renting. And again, we're just not ready to cope with the scale of what that means. And so you are, so that sense of urgency, I suppose, is something that needs to be there. But also the very real calculations that need to be made, at a government level. If you look at the amount of HAP you'll be paying potentially for 10 years per person for hundreds or thousands of older persons versus what would it cost to pay off the building of apartment blocks that would be suitable. And that calculus, it needs to be done and needs to be done quickly in terms of, because that's the pressure that's coming down the tracks very quickly.
Yeah, that's one of the things, and we've had this conversation, I think, many times offline. But one of the issues we have it's the nature of the crisis creates this issue in housing, is that policy development happens in a sort of a liberal democracy, particularly European democracy, tends to happen piecemeal and gradually. And that can be a good thing, because it means if people fall out of the lorry or the bus, or the wheel falls off, you have time to repair things and sort of carry on. But when you're in a crisis situation, and the comparisons, I suppose, I'm not sure directly fair comparisons, but I think they're informative, is things like the financial crash or COVID, where we saw a truly crisis response from government, which is single-minded and focused. And I think one of the things, the conclusions that we're coming to more rapidly is the talk of a housing crisis and a homeless crisis for the last 7 to 10 years hasn't been met with truly crisis response. And the demographics now, what you presented today highlights, is the demographics also show that we now need to get to that crisis response. And probably we need to take a huge crisis level step forward to be able to get back to incrementally and keeping everybody in the boat. And I think so taking that laser focus, that's why I think we're trying to get to the one or two things that need to be done, and the one or two things that need the level of focus, because there is nothing, and we both know this over many years, there's nothing that's easily done in housing, but there are things that can be done.
Well, exactly. I mean, you mentioned earlier the thing about pilots, and the difficulty with a housing pilot, it could take 5 years. You have to build an apartment block to see if it works as a retirement village. So there is a need to either have a lot of pilots or to be, moving very rapidly to full implementation. And I agree with you on the crisis, but another thing to bear in mind is that the location where we're going to need housing isn't necessarily the places where we're seeing the most house building. Because if you look at the fastest growing counties, sort of Meath, Kildare, Fingal, in terms of the greater Dublin area, obviously surrounding the bigger cities, you have the lowest percentage of people in the older age bracket, because it tends to be younger families and workers moving into those areas. So you have quite different demographics, whereas most older persons are either in the old cities of Cork and Dublin, or in the suburban areas, not in the new apartment blocks in the centre at all, or to a very small extent. And they're also in rural areas. And so they could be in a local authority area where there's not a lot of house building going on because there isn't a lot of economic activity for workers and young families. But actually, if they want to address the housing needs of older persons, they may need to be building apartment blocks or to building other types of housing to meet that need. And they may need to be ramping up that scale in a way that they're not anticipating, because I'm speculating, but I would imagine a lot of the focus in terms of house building is on the labour market and the needs of workers. Whereas the needs of older persons are coming down the tracks. And if they're not able to stay in their own home, but they want to stay living independently in their community, then that's a source of housing need, which may not be fully anticipated in terms of where housing is being built and the type of housing that's been built all around the country.
Okay. I think that's kind of I think that brings us back sort of quite neatly to your point that we need to reimagine or rethink or remodel our housing system. And I think that's true for understanding the pressures that's creating homelessness. And it's very true as well for understanding the demographics changes in our society as well. So I think that's kind of a neat way. And we're almost bang on the hour at that. So I think that's probably a very neat way to finish up. I want to thank everyone for attending, and just to remind that we will be putting the chat up on YouTube, so do share in your networks and share with your colleagues, because I'm sure they'll find it as informative and useful as I have. And finally, just to thank Nat for your time and for your excellent analysis and for sharing it with us.
Thanks very much indeed.
Thanks everyone.